Hipec is hyperthermic intraperitoneal chemotherapy. So it is chemotherapy given within the peritoneal cavity, usually after cytoreductive surgery or extensive ovarian cancer surgery. It's a different form of giving chemotherapy, and it's in addition to the standard intravenous chemotherapy that is given routinely as part of ovarian cancer treatment. And there is data in the literature which suggests that it may potentially improve outcomes in some situations in women who have cancer. So there is a lot of literature which has been emerging and which has come over the years from the colorectal or the gastrointestinal cancer management literature, particularly from things like pseudomyxoma peritoni or widespread intraperitoneal mucinous carcinomatosis. And there's evidence of improved survival with Hipec, along with cytoreductive surgery for peritoneal carcinomatosis in the colorectal cancer situation. And given that ovarian cancer has also got characteristics of peritoneal spread or dissemination, and therefore is a peritoneal surface malignancy too, it has raised the interesting question of whether ovarian cancer patients would also benefit from this form of treatment. And that has been investigated in a number of studies. Most of them have been cohort studies. The literature is fairly heterogeneous, so they are different. They use different types of drugs, different doses, different ascertainment criteria. But recently there have been 2 randomized controlled trials, one presented as an abstract at ASCO. It was a Korean trial of about 184 patients, which included both women who were going for primary debulking surgery and interval debulking surgery. And that trial did not show a benefit of overall survival or recurrence-free survival following Hipec. But in the women who received neoadjuvant chemotherapy, there was a definite difference and potential benefit. But details of those outcomes are not yet available because the paper is not published. So it's very difficult to draw more firm conclusions or try and analyze the data properly from that study. There was recently a Dutch study which was published, which evaluated Hipec in about 245 women, and that study reported a benefit in recurrence-free and overall survival. There have been some criticisms of the design of the study and biases and things, and the fact that it's been there for 9 years, taken 9 years to recruit patients, amongst other things. There is no perfect study in the world. There'll always be some criticisms from some trials. Nevertheless, within these limitations, I think it's providing initial data to suggest that this needs to be investigated more and may be an area where some women will benefit or could benefit. I think the precise situation of which subcohort or which selected group of women will benefit is yet to be completely more precise, defined or well elucidated, and it does require more research in the future. There are centers in the world which do Hipec, and was one of the things we had was a discussion at BCGS on other potential centers who may be interested in taking forward this new method of treating women within the UK, and hopefully it's generated a debate and discussion on this issue, and one hopes that there'll be other people taking up this new technique, and we will be able to develop the know-how, at least, to do this, and then be able to plan subsequent trials in the future to answer a number of the questions that need to be answered to better define its applicability going forward. The initial data clearly call for more research in this area to better understand and define what its applicability may be. and it may be in just a selected subcohort, but that needs to be defined.